Welcome back to Learning Anatomy with Dr. Bakare. Here we simplify anatomy and we also learn anatomy with so much fun. In this lecture, we would be looking at the acromioclavicular joint. As I've always said on these channels, for us to always break down the name. If you break down this name, you will see that this joint exists between the acromion of the scapula and also the acromial end of the clavicle. Let's say this is where we have the scapula here at this point, and this region where this arrow is pointing is where we have the acromion of the scapula. And this is where we say we have the clavicle in the anterior region. And also this region where this arrow is pointing is where we have acromial end of the clavicle. The acromioclavicular joint is situated between these two sub-regions, and this is what is arrowed here in yellow. So we say that the acromioclavicular joint is seen to exist between the acromion of the scapula and also the acromial end of the clavicle. So let's drive through this lecture where we'll be highlighting the details of the acromioclavicular joint and some other important features that you should know as students of anatomy. The acromioclavicular joint can also be referred to as the AC joint, which also means acromioclavicular joint. And this joint we say exists between the acromion of the scapula and also the acromial end of the clavicle. Using this image by the side, this is where we have the acromioclavicular joint here, carried in green. Remember in our previous lecture when we described the sternoclavicular joint, which is the joint that occur between the sternal end of the clavicle and also the manubrium of the sternum. This is what is located in this medial region. If you've not checked that lecture up, please kindly go and do so. But for the purpose of this class, we would be focusing on the details of the acromioclavicular joint. So we say that the acromioclavicular joint is seen to exist between the acromion of the scapula. This is where we have the acromion here of the scapula that is arrowed in red. And this is where we have the acromial end here of the clavicle. We know that the clavicle is a modified long bone that is horizontally placed. And because it is a long bone, it is expected to have two ends. And this is why it has the medial end that can also be referred to as the sternal end. And this is the region here where this arrow is pointing. It is through this sternal end or medial end that it relates or connects with the manubrium of the sternum. And this is what creates the sternoclavicular joint. We already described this in details in our previous lecture on the sternoclavicular joint. The lateral region here is where we have the acromial end. And we say that this end is laterally placed. And it is referred to as the acromial end because it is through this end that it connects or is related to the acromion of the scapula. So we can see how these names here are drafted, and it is important that we understand the details behind this. If you try to use this lower image, this is where we have the scapula. This is the posterior surface of the scapula. And this region where this arrow is pointing is the spine of the scapula. The spine of the scapula is seen to divide the posterior surface of the scapula into two uneven foci. We already also described this in details in our previous lecture on the scapula. If not check up that lecture, please also kindly go and do so. We say that it is the spine that runs laterally, and at this lateral region, it becomes expanded. And this is what transforms into the acromion. So this is how the acromion of the scapula is formed. And it is this acromion that fits or connects with the acromial end of the clavicle. And this is what is also arrowed at this point. So these two creates the connection points that is referred to as the acromioclavicular joint. It is also important that we highlight the coracoid process. Using this image by this other side, this is where we have the coracoid process here, carried at this point. This is like a finger-like projection that is seen over the glenoid cavity. This is where we have the glenoid cavity here, where this arrow is pointing. And this is an indentation that is created on the lateral side of the scapula, where the head of the humerus fits into to create the shoulder joint or the glenohumeral joint. So you have a beak-like structure that is seen to curve over the glenoid fossa or glenoid cavity. And this is referred to as the coracoid process. So it's important that I like this because we would be making reference to this process during the course of this lecture. And this is where we get to a point where we'll be highlighting the different ligaments that will be supporting these joints. It is also important that we had that in classifying the acromioclavicular joint, we say that it is a synovial type of joint, which means that it has synovial apparatus embedded within it, but it is specifically a plain type of synovial joint. And we'll be highlighting the details behind this. If you look at the articulating surfaces of this joint, you see that they are almost seen to be flat, which means that they are seen to take a plane alignment, even though they have synovial apparatus embedded within it. So if you try to use this lower image, this is the point where we say we have the creation of this joint. And if you look at the articulating surfaces, you see that they have nearly a plane alignment. And this is why they are classified as a plane type of synovial joint. Now let's describe the morphology of this joint. We already know the different subregions of the clavicle and also the scapula that are responsible for creating this joint. So let's dive into the articular surfaces. This joint has two articular surfaces, and if you try to compare it with the sternoclavicular joint in our previous lecture, we say that the sternoclavicular joint has three articular surfaces, and these include the sternal end of the clavicle, the clavicular notch of the manubrium, and also the first costal cartilage. We already described this in details in our previous lecture on the sternoclavicular joint. So for the acromioclavicular joint, we have the acromion of the scapula. If you try to use this image by the side, this is where we have the acromion of the scapula. We already described how this acromion is formed. We say that it is a lateral expansion of the spine of the scapula. We already described this in our previous slide. So this is where we have this extension laterally, and you see that this extension is driven forward so as to be able to accept or receive the acromial end of the clavicle. If you drive deep into this surface, you see that it is slightly concave, which means that the concavity that it presents is not sharp. So the second articular surface is the clavicle, and specifically it is the acromial end of the clavicle. And this is what is harrowed at this point. Remember, we said that the clavicle is the long bone, and long bone are generally seen to have a shaft and also two ends. So one of the ends here is the acromial end, and this is located laterally. And at this lateral region is where it is able to articulate with the acromion of the scapula. Remember that the acromion of the scapula is already also driven forward so as to connect or articulate with the acromial end of the clavicle. So these are the articulating surfaces of the acromioclavicular joint. It is also important for us to note that these surfaces are lined by fibrocartilage. If you go to other type of synovial joints in the body, you see that they are generally lined by hyaline type of cartilage. But for the acromioclavicular joint, it is different. And this is where you see that it is lined by a fibrocartilage. If you go back to our lecture on the sternoclavicular joint, you see that articulating surfaces also in the sternoclavicular joint are lined by fibrocartilage. So these two joints are kind of similar in this regard. And if you drive deep into the acromial end of the clavicle, you see that it is also slightly convex. And this means that the convex alignment is not sharp. And if you try to unite this with the kind of slightly concave presentation of the acromion of the scapula, you see that it will be presenting a kind of plane alignment. And this is why we say that it is a plane type of synovial joint. We already know that synovial joints are seen to be embedded in with a synovial apparatus. And because of the flat alignments that will be created around this space, even though we have a concave convex arrangement, these are seen not to be sharp. They are seen to present almost a flat kind of configuration. It is also important that we had that the articulating surfaces are kind of equal in sizes. If you go back to our lecture on the sternoclavicular joint, remember we said that the sternal end of the clavicle is bigger than the indentation that is created on the clavicular notch of the manubrium. That is in the creation of the sternoclavicular joint. So one of the articulating surfaces is bigger than the other. But in the acromioclavicular joint, articulating surfaces are kind of equal in sizes. And if you go back to the slightly concave and convex arrangement, you see that these two articulating surfaces are not perfectly fitting into each other. And this is why we need the support of ligaments, where they will be helping to further reinforce this joint. It is important that we highlight this in describing the details of the acromioclavicular joint. Also to add that there is an intra-articular disc. This intra-articular disc is made up of a fibrocartilage. Remember that in the sternoclavicular joint, we also have this kind of disc also embedded within the joint cavity. This is also seen in the acromioclavicular joint, but it varies greatly. This is what is seen to be projected here in red. It may be seen in some individuals and not be seen in others. It is also seen to vary also in size. Some individual, it may be bigger, while in some, it may be smaller. Also, within an individual, on the right side and also on the left side, it also varies. So you can see that it varies greatly between individuals and also within individuals. And in the acromioclavicular joint, it is seen to help absorb shock and also create cushioning effect. This is the function that it exhibits around the space. If you try to go back to our lecture on the sternoclavicular joint, you remember in that lecture, we said that the intra-articular disc of the sternoclavicular joint is what actually transformed the sternoclavicular joint to exhibit a wider range of movements that is exerted by the ball and socket joint. So you see it transforming it physiologically from one form to the other. While in the acromioclavicular joint, this kind of presentation does not exist. It is just there for it to help absorb shock and also create cushioning effect so that the articulating surfaces can slide freely over each other without friction. The articulating surfaces are then seen to be lined by synovial membrane. We know that the synovial membrane is what is responsible for producing synovial fluid, of course, within the synovial cavity. So this is why it is tagged a synovial type of joint. And because of the plane alignment that it presents, even though we have a slightly concave and convex arrangement, you see that this arrangement is not sharp, they are not intense, and this is why you have this plane alignment around the space. And this is why we classify it as a plane type of synovial joint. Remember, in a sternoclavicular joint, we say that it is a saddle type of synovial joint, while the acromioclavicular joint is a plane type of synovial joint. We already also described the basis behind the saddle presentation of the sternoclavicular joint in that lecture. So now let's highlight the different ligaments that are responsible for supporting or anchoring the acromioclavicular joint. We have a number of ligaments, and the first one we would be looking at is the acromioclavicular ligament. As I've always said on this channel, is for us to break down the name. If you break down this name, you see that this ligament runs between the acromion of the scapula and also the acromial end of the clavicle. And using this image by the side, this is where we have the acromioclavicular ligament here highlighted in black. This ligament is divided into two subsets. You have a superior subset and an inferior subset. And this is what is highlighted here in black. And you see it helping to reinforce this joint in this anterior region. So you see it connecting the acromion of the scapula to the acromial end of the clavicle. And we know that these two sub-regions is what is responsible for creating this joint. So you see ligaments running to and fro the two articular surfaces. Then the second ligament that we have supporting the acromioclavicular joint is the coracoclavicular ligament. The coracoclavicular ligament is a ligament that runs from the coracoid process of the scapula to the clavicle. And it is seen as a complex type of ligament because it is like a two-in-one ligament, and we will be driving into the details of how this ligament is formed. We try to use this image by the side highlighted at this one. You can see it connecting the inferior border of the lateral region of the clavicle to the coracoid process. And this is what is seen here at this point. If you drive into the formation of this coracoclavicular ligament, so let's try and use this lower image here to describe this ligament. This is where we have the inferior surface or the lower surface of the clavicle. So it is tilted outwards for us to be able to see the projections on the inferior border or surface of the clavicle. So this is where we have the medial side. This is where we have the sternal end here of the clavicle, and this is where we have the lateral side that is also referred to as the acromial end of the clavicle. Towards the lateral end or lateral region, or we can say that the lateral 1/3 of the clavicle, we have two tubercles. We have the conoid tubercle here that is arrowed in yellow. This conoid tubercle is what gives the attachment site for the conoid ligament, just a corresponding named ligament. Then if you go more laterally, you have the trapezoid tubercle, and this is what is highlighted in blue. This trapezoid tubercle is what gives the connection and attachment site for the trapezoid ligament, just a corresponding name ligament also. So you see the emergence of these two ligaments, the conoid ligament originating from the conoid tubercle, which is located on the medial side, and also the trapezoid ligament, which of course originates from the trapezoid tubercle, which will be on the lateral side. So these two ligaments emerging from the inferior surface or border of the lateral region of the clavicle at this point, you see them running and are finally inserted on the coracoid process of the scapula. And this is what creates the coracoclavicular ligament, from the coracoid process of the scapula to the clavicle, specifically the inferior border or surface of the lateral region of the clavicle. And this is what is projected here in this image. So you see that this coracoclavicular ligament is like a two-in-one ligament, having a medial compartment and a lateral compartment. The medial compartment is formed by the conoid ligament, while the lateral compartment, which is located more laterally, is formed by the trapezoid ligament. So these two ligaments will come together to form the coracoclavicular ligament. And they are seen to help reinforce the acromioclavicular joint because they connect the coracoid process of the scapula to the inferior border or surface of the clavicle, specifically at its lateral region. So this is what is projected here in this image. So now let's go to the blood supply. The blood supply of the acromioclavicular joint is by two vessels. One is the thoracoacromial artery. The thoracoacromial artery is a branch from the axillary artery. Let's try and create how the thoracoacromial artery originates. This is where we have the arc of aorta. We know that from the arc of aorta, we have the subclavian artery. This subclavian artery will run and finally becomes continuous as the axillary artery. It is from the axillary artery that we have the emergence of the thoracoacromial artery. The next supply is from the suprascapular artery. The suprascapular artery is an emergence from the thyrocervical trunk, which emerges from the subclavian. So remember, this is where we have the emergence here of the subclavian from the arc of the aorta, and it gives off a thyrocervical trunk. From the thyrocervical trunk, we then have the emergence of the suprascapular artery. So this suprascapular artery also contributes to providing the blood supply to the acromioclavicular joint. So these two vessels are seen to supply this joint. While the innervation of this joint is by the lateral pectoral nerve and also the axillary nerve. These two nerves are emergence from the brachial plexus, and these are seen to innervate the acromioclavicular joint. The acromioclavicular joint exerts a multi-axial type of movement. So it's able to exert movement in multiple directions. So we see it exerting elevation and depression, protraction and retraction, and also rotation. Thanks for watching this video. Let's continue to stay glued to my channel.